Well, thank you very much, Amy. If I was really powerful, I'd be able to get out of being on call, I think. It's true, I am on call, but I'm going to stay as long as I can. I'm going to sit at the back, though, in case I have to leave early. When Sophie Kiwala was talking about how every family has been touched by mental illness, I sat there counting up the people in my husband's and my immediate family, and I got to 4 people with schizophrenia or alcohol addiction in our own close family. So it's certainly your family, it's my family, it's all of us. I also want to say good for all of us for coming out on a Saturday afternoon, really the first day of spring, and sitting inside to talk about such an important issue. I think it really speaks to the level of interest and passion and commitment we have in this community. So I'm going to talk about 3 things. They're very simple. I'm going to talk about health, I'm going to talk about sickness, and I'm going to talk about getting help. So health is, in my view, something that you can't divide up into packages. It's a whole package, and it's to do with your physical health, your mental health, your spiritual health, and your social health. And the road back from illness and the road to staying healthy involves all of those things. So a lot of the advice that I give myself and try to take, and the advice I give my patients, is pretty simple stuff. It's about eating properly, getting enough sleep, avoiding getting addicted to drugs and alcohol. I'm a big believer in exercise, and I'm sure some of the other speakers will talk about how we know that exercise in many cases can have an equal amount of efficacy as some of the medications that we use for mental illness. So I'm always talking to patients about getting active, and I have my Fitbit on today to track the steps that I'm going to take in the course of the day. All right, so our physical illness, mental illness and mental health, I'll talk about more in a moment. But spiritual health, of course, is also part of our wellness. And spiritual health, to me, has to do with knowing the purpose of our lives, the meaning of our life, particularly at the end of our life, thinking back over what the point of our life has been, thinking about what we want to accomplish, the kinds of relationships that we want to have, being in a spiritually healthy place. And that, of course, is closely linked to the community and the social health that we have. We need to have good supports from our family, our friends, the circles that we're in that provide us with that opportunity to have good social health. But beyond that, we need to live in healthy communities, and that's part of why we're here today. We need clean water, clean air, roads that we can walk on, bike on, move on, communities that are organized to be supportive of each other. And all of those things together make for health. You can't divide it up into one sort of health or another. Health is all of those things together. But illness, the second thing I want to talk about, we can talk about more specifically, and that's part of what science has to bring to mental illness. Because science has allowed us to, by naming and delineating and understanding the origins of a number of diseases, has helped us develop treatments, medications, other strategies that help overcome illness. So many mental illnesses that we used to think had a psychological origin, we now know have an origin in the brain itself, or in a genetic predisposition, or in a combination of genetic influences and adverse childhood events and physical illness perhaps coming together to cause a mental illness. So there's a great deal of benefit actually in dividing up illness because an accurate diagnosis can lead to a very helpful treatment. So although health is indivisible, illness, it is possible to divide up and think about specific treatments for. And that brings me to seeking health and stigma. One of the things I love about being a family doctor is that if you're sitting in my waiting room, and I hope you don't have to sit too long, but if you are sitting in my waiting room, no one knows why you're there. And you could be there because of your heart attack, or because of your sore thumb, or because of your sadness, or your depression, or your anxiety, or a whole host of other complaints. And the other lovely thing I like about my work is that I don't see just diabetics or schizophrenics. I see people who have diabetes and who have schizophrenia, and sometimes they're the same person. I see people over many, many years. I see them in their family context, and I see the mental illness that they may be suffering from in the situation of their whole health and their whole family and community situation. So I love my work because I can, I think, help overcome stigma simply by providing care to a whole range of people with a whole range of problems and not just one kind of problem. I love my work because I can provide care to people in all ages and stages and in the context of their families. And I love my work because I have the ability to use a variety of scientific tools to help people get better. I can prescribe medication, I can refer to specialists who may be able to help in particular circumstances which are beyond my knowledge. So all of that I think is very helpful. So I encourage people when you're wondering, is what I'm feeling sadness, or am I really depressed? Or is it normal to be this worried? Or I'm not sleeping, is this part of an illness, or is this something else? Or if you're just not sure what's going on, I think your family doctor is a very good first line person to talk to try to put it in context for you as to whether this is something that's within the range of normal, whether this is something you can handle on your own with some coaching, whether you need some more specialized intervention, whether you've even got the right diagnosis, or whether this is something completely normal and not anything to worry about at all. And that's one of the things that we can offer in primary care and family medicine.
All of you for coming here. As Ruth said, first day of spring and everybody's inside. That's amazing, and this is really shows the importance of the topic we're going to discuss today. I think when we talk about mental illness or mental health or lack of mental health, we're really touching on something which is very important, and mental illness or problems with mental health are so common that they're so ubiquitous. They're everywhere in the society. Ruth was saying, Dr. Wilson was saying how many people from her family, but when you look statistically, it's really very, very, very common. And more than that, it's really the impact of that illness is huge. The impact on the individual, the impact on the society, and this is something which has been recognized now by virtually everybody who works in this field. So I'd like to talk a little bit about stigma. Stigma of mental illness is really something which is unique to mental illness, but at the same time, if you look back only 30 years ago, a lot of physical illness used to have stigma. Just only 20 or 30 years ago, you couldn't go to work and say, you know, I got cancer. And now it's quite okay. There's still illnesses which are associated with a lot of stigma, and in some other countries, for example, leprosy is associated with a lot of stigma. Unfortunately, mental health, mental illness is always been associated with stigma, and although we see some changes with some specific disorders, it's still around quite a lot. How many of you can go back to work tomorrow and say, last night my suicidal thoughts were bothering me so much that I couldn't sleep? I mean, that's impossible even to think that you can say that. Or so what that is the stigma of mental illness, which is so commonly across the society. We integrate in our own thinking, and we behave as a member of the society with that stigma internalized, and we talk about self-stigma. When we talk about self-stigma is very important to recognize, because the self-stigma prevents us, when we become ill, when we become depressed, to seek help. And I'm trying to find 17 different excuses why I'm depressed and explanations, rather than go and seek help for that. And this is the importance of studying self-stigma and actually working with people about that. Unfortunately, when you look at it from the point of view intuitively, it's very clear. Stigma is misinformation. So if only we do some more education about mental illness and about how it affects, the stigma will disappear. Unfortunately, it doesn't work like that. And numbers of studies and attempts have been done. The most recent one, some of you may be aware, in the UK, there was a national program for 4 years for education of mental illness. And when they measured very carefully what they achieved after that program 4 years later, not much has changed. And this is very, very, very troubling finding, because education does not seem to help. And it doesn't seem to help because the stigma is a belief. And when you believe in something, no matter what other people will tell you, you don't change your beliefs just like that. So most people who work in stigma have now focused on a different approach. And the different approach is work with young generations, teach them sensitivity, understanding of differences, and actually with that work in a couple of generations, hopefully stigma to mental illness might disappear. We have taken a slightly different approach, and our team, together with Heather Stewart from Queens, and many of you probably know her, we have done something very different. We have said, let's talk to the person who experiences stigma, and let's help them how to deal with that constant stigmatizing behavior of their relatives, their family, their school, their work placement, the society, etc. And we have created a short course, about 7 sessions, and this is what we do. We are currently studying it. We want to make sure that this course really works before we can use it for everyday work. I'd like to talk a little bit about the mental health services and what we have here in Kingston. And Sophie, she mentioned so many organizations, and yes, we have a lot of organizations, and many of these organizations do fantastic work. And that fantastic work is due to the dedication of people, understanding people, want to help. Unfortunately, there is a missing link here. And the missing link is they forget to talk to each other. And when you go and see somebody, you receive fantastic care, but God forbid if you don't fit their admission criteria. Then you have to be referred somewhere else, and nobody knows where. My wife is a family physician in town. She asks me sometimes, where do I refer a person with this? And I said, I don't know. She said, you work in this system for 15 years, for goodness sake, so you should tell me. And I said, I don't know. And this is an example of that. So we have fantastic services, but they're not linked that much to each other. So it was mentioned, I think Sophie mentioned that, but we have made a major step towards that with the recent creation of a new organization, which is called Addiction and Mental Health Services for Kingston, Frontenac, Lennox, and Addington. It's a mouthful, and it's difficult to say, but basically this is an amalgamation of 2 major services some of you might have heard for years, and the one is Frontenac Community Mental Health and Addiction Services, and the other one is Lennox and Addington Community Mental Health Services. So this is really a step in the right direction. Now, when we spend a lot of time advising the LIN and working with the LIN, how do we do that? We dreamed big, and we said, no, we should go big way. We should amalgamate everything. Well, it's not possible, apparently, but this is the step in the right direction, and I'm very, very, very happy to say that this is really very promising, and it will open the door for a lot more communication and integration. And one thing I'm very proud to say is that I work with this organization as well as their external medical director, and I help to integrate the services further. Okay. Is that better? Holy, I should have done. Do you want me to repeat what I just said? I can start from the beginning. No, I'm joking. Okay, so the last thing I wanted to really tell a little bit is about our Department of Psychiatry. Department of Psychiatry is a department which is associated with Queen's University. All of the members of the department are also faculty with Queen's. We provide the majority of clinical services, as you heard, at Outtitled Hospital, KGH, Providence Care, the new entity, Addiction Mental Health of Kingston, Frontenac, Lennox, and Addington. We provide services with Onconada and other organizations, with children's organizations, etc. We provide a lot of services to family health teams in the form of shared care. We provide telepsychiatric services to many other organizations, most notably the Métis Nation of Ontario, etc. So, in a way, our department serves as a natural integrator of these wide array of institutions and organizations providing. And I think that gives us a unique opportunity to really work between the organizations and with the organizations to try and help a better links between the organizations and services, and to improve the service for people with mental illness. We have a very strong teaching program. We teach the future doctors and specifically the future psychiatrists. We train a lot of nursing staff with occupational therapists. We are involved in some teaching for social workers, etc. We are very active in research, and it was mentioned some of the major research projects we do, like Stigma. We are currently involved in a very large study which is really looking into improving the ability to predict who is going to respond to what treatment. And we are halfway through this large study. It's a 5-year study, so I'll be happy to report maybe next year or in 2 years some of the outcomes of that. So with that, I'll stop. I'll be around, so if anybody wants to chat with me or meet with me, I'll be happy to do that. Thank you very much.